welcome back. Well, today I am joined by Dr. Jeffrey Altschuler, who is here on behalf of MemorialCare. Well, Dr. Altschuler, thank you for joining me today.
Sure thing. Great to be here.
Well, there's an awful lot of discussion, cardiovascular disease, and a variety of other things that are associated with the heart. And we do have lots of residents who I know are concerned about some of those things. But today we're talking about the aortic valve replacement. But before we do that and dive into that, tell me a little bit about yourself.
Well, I'm new to Southern California in the last year and a half, 2 years, spent 30 years of my career in the Detroit area.
Okay.
And then originally a Detroit native, moved out here with one of my partners in practice to bring minimally invasive valve surgery and cardiac surgery to this area.
Okay. Wow. All the way from Detroit. Are you liking California?
Oh yeah. Can't beat the weather and a lot of stuff to do outside, which is great.
Exactly. So when we talk about an aortic valve, will you just remind our residents what it is?
In the heart, there's several valves, but the aortic valve is the main valve out of the heart that separates the heart from the blood vessels. The aorta is the main artery out of the heart, and this is the valve that separates the two. So when the heart beats, the valve opens, lets the blood out. When the heart relaxes, the valve closes so the blood can't leak back into the heart.
And when it has disease, what does that entail?
There's two things that can happen to the aortic valve, basically. It can leak too much, so that puts the strain on the heart because of the extra blood leaking back into the heart. But more common is what's called aortic stenosis. That's where the valve actually scars down and gets smaller and smaller and smaller. So the heart, like any pump, if it's got to pump blood through a smaller and smaller opening, it just has to work harder and harder and harder to do that.
Well, right. And so I would imagine that would obviously affect the way the heart works. What are some of the symptoms someone might feel if that was happening?
Well, there's three common ways that people with aortic stenosis show up at their doctor's office. First, they think they're having a heart attack, chest pain, angina. And even in the absence of any blockages of the artery, the heart muscle can get so big and thick that it needs more blood than normal arteries can supply. So you feel like you're going to have a heart attack. Mm-hmm. The other thing that happens to people is they just pass out. They have drop attacks. The heart just can't do the work it has to do temporarily. You pass out, less strain on the heart, you wake up. And the third way people usually present is with heart failure. And if you can think of the heart as a muscle, it just gets overworked and it goes, I can't do this work anymore. It's like giving you a heavier and heavier barbell. Sooner or later, your arm's going to poop out and say, I can't do this anymore. Right. And that's what happens to the heart.
So now when you visit your regular primary, aren't they checking for something like this at some point in your life, like depending on age?
Sure. Listening for murmurs, they listening to your symptoms. Those are the two main ways that comes to light.
Well, what about like if you have an EKG, does that present any?
It may show signs that the heart is enlarged or strained, but it won't be specific to the valve. It may show that further investigation is needed.
Okay, so once someone does recognize that this is a symptom, how do you then evaluate it?
Most common way is just with an echocardiogram, and that can quickly and easily define what is going on with that valve.
All right, and then once you find that this particular valve, has some sort of blockage, what do you generally do?
Well, the two ways, there's no medicine that's going to make that valve function normally again. So you have to basically replace the valve. And again, conceptually, you can think of the heart as a muscle and it's trying to lift 50 or 60 pounds with a barbell. And what we want to do conceptually is take away that 50 pounds and give it 20 pounds back. Mm-hmm. There's two ways of doing that. Most people are familiar now with TAVR, percutaneous valves, and the surgical aortic valve replacement.
Mm-hmm. Mm-hmm. So can you help me understand the difference?
Yeah, well, the TAVR is all percutaneous. It's done with catheters and directly through the blood vessels. Surgical valve is open heart surgery. One of the things we've brought to this area is minimally invasive surgery. So we can do a surgical valve without having to cut the breastbone in half.
So then
Makes the re-
how are you actually inserting the valve?
Where we make a small incision, you can see my lab kind of right about there over the rib on the anterior chest wall, maybe 2.5, 3 inches.
Okay,
We have to hook you up to the heart-lung machine still, and we open the aorta just above the valve and cut out the old valve and sew in a new valve.
wow.
That recovery is much easier than having your breastbone divided. It's just much less trauma on your body.
I would imagine. And how successful is this particular type of surgery?
Very successful. Me and Dr. Sakwa over the last, we started doing this in 2008, have done 4,000 to 5,000 aortic valves, and the results are excellent. If you look across the board, chances of dying are very low, chances of infection are very low, recovery time in the hospital is much shorter than having your breastbone cut in half.
Right. Now this particular replacement that you're doing, does it last for a long time?
No replacement. None of the typical of these two valves that we use, the TAVR valve, nor what's called sometimes is referred to as a pig valve, but a tissue valve. Neither of them last a lifetime. There's a metal valve that lasts a lifetime, but that has to be implanted surgically. That cannot be implanted through the blood vessels.
Right.
But no matter what tissue valves used, that'll wear out over a course of a lifetime.
Okay. Okay. So not a permanent situation, but something that'll help get you to the next phase.
Correct.
Okay.
Correct.
All right. Now, of course, this wouldn't all be happening unless something was obviously happening with the body. And I'm sure there are many recommendations that you would have to help people not have this happen to them. What are some things?
Well, in terms of aortic stenosis, it's not like having blockages in your arteries where you can say you watch your cholesterol, don't smoke. There's nothing specific like that. But a healthy lifestyle will certainly make any intervention that's needed for your aortic valve much easier and much lower risk than if you're a smoker, if you're obese, if you're uncontrolled diabetic. So a healthy lifestyle helps in any, future health events.
That's great. That's great. Well, anything that I might have missed that you'd like to let us know about this?
Not that I can think of is, just don't be scared of your health problem. Get it evaluated and taken care of early. That's probably the best thing.
Well, exactly. And with so many people who were so afraid during our pandemic, now they can go back to their regular doctors and definitely get things checked out. They don't have to wait. So good advice. Thank you so much for joining us. I appreciate it.
My pleasure. Thank you.
All right. And we'll be right back after this.